Good evening, everybody. Welcome to day 6 of our 7-day series, More Than Medicine. Today, I have three very interesting people from different aspects of medicine: pediatrics, internal medicine, and family medicine. Today, we have Miss Dr. Iya Abeliani. She has graduated from Tbilisi State Medical University. She has a PhD from TSMU and University of Paul Sabatier. She has a specialization in cardiology and specifically in invasive rhythmology. I would like to invite Dr. Iya Avaliani.
Thank you, Lekha.
Okay. Thank you so much for being here.
Thank you, Lekha.
And
hello, it's my pleasure and honor to be today your guest.
Thank you. So we recently did cardiology together, and I must say it was very interesting to get into interventional and invasive cardiology, because when you are a medical student, cardiology is kind of very daunting when you think about rhythmology, which is something you specialize in. Especially ECGs have been very scary when you start learning about them. But then eventually you get used to figuring out the little pathologies. So tell me, what fascinated you about cardiac arrhythmology?
Generally, I would like to start with this just introduction. I have some questions later from you. I'll be, of course, answering them. But to this story, how I became doctor, I think it's quite banal, and maybe many of you had the same story. This was dream of my mother, in fact, to become a doctor. She wanted very much, but her mother decided that she had 3 children and she wanted one to be doctor, another to be engineer, and one to be a teacher. So because already there was a doctor in the family, so the only profession she could choose, she became the professor of English. So she had to say no to this career of doctor, but she was always dreaming about this. So whenever later I started to think already, so what I want to be, already probably I realized the dream of my mother, but it was something that I wanted to. I have brothers, cousins, all boys, and when they were playing games, some wars or some soldiers, I was always a doctor. I had very small white coat even when I was child. I mean, 3-4 years old. I was always helping the soldiers. I was doing some injections to my dollies and some others. So I knew that I always knew that I'll be a doctor. And later already, so when I was already studying at primary school, and I was sharing my idea that I want to be a doctor. Some others of my friends were changing their ideas. Sometimes they want to be musicians or some artists or painters or whoever. But I always knew from the beginning that I'll be a doctor. And then I went, okay, doctor, but of which profession? So already, probably from the 5th or 6th grade, I started thinking, so what I like more. And already, I don't know why, I passionate with cardiology. I was saying, okay, I've chosen this profession so early, and I was saying, okay, maybe if I'll not like it later, I will change my idea. But no, when I entered university already, so I knew I'll be cardiologist. When I graduated, I knew I'll be cardiologist. And during the 6 year, I never hesitated. So it was my dream from the very beginning. And very important here was the role of my teacher of pediatrics. She was my ideal, maybe because that's why now I'm teaching in the same department, because my teacher influenced, because I loved her so much. She advised one small book. It was called Hampton's The Basics of ECG. And he taught not just to me, to all my friends. Okay, so there was the research book in English. No, it was in Georgian, I think already. It was just translated. And they told me, if you want to study ECGs, just read this one. I think we have time, so I can maybe tell a story. I think it's quite interesting story.
Definitely.
If you want to speak about others, we can later discuss about this. This is a story I'm telling to my students frequently, and because it's very interesting how, maybe, I don't know, it seems for them interesting. So maybe for US
it's really inspiring that you chose a path very early on and decided to stick to that. And it's kind of rare to hear those stories. So please feel free.
Yes. Yes, maybe. Yeah. So, yes, how later it was contributed. So, this teacher advised to all of us. It was in the end of the first semester, on the fifth semester, so first semester of Pediatrics. So we studied some ECGs on the class, but she told, of course, we can't study everything here. So later, please go and buy these books. It was a very small, teeny book of this recently translated to Georgian, so Hampton. And we all bought this. It was quite cheap book. We had no other books at the time. Everything was in Russian languages. So it was really, we had something from from English author, something. And we bought it and we said, okay, after exams, after the sessions, I will be studying this. We'll be reading. All my friends later, so we all bought. But later it happened that after exams, I fall sick. I got some flu, not very serious disease, but I could not accompany. So all my friends went to Bakuriani mountain resorts. They all put this book in the bag and they said, okay, we'll be studying there. And I was alone. I was running a fever. I had headaches. I was staying at home. There was no mobiles. And I was thinking, okay, my friends probably are studying together and they probably already finished the book and I'm sitting alone. I have high fever. But still I started to read it. And we had some guest, very old doctor from village. He came to visit us. And once he saw me, what you are doing? Because I'm reading the book about ECG. He told me, no, you can't study like this. You have to take a pen, notebook, and fill one notebook with ECGs, normal pathologies. And then just in this case, you remember something. Because reading is not fair till you forget. And I obeyed. Recently, I'm obeying recently other people's. But I obeyed this man because I knew that he was a very good doctor and professional. So really, I filled one notebook with ECGs, normal and all pathologies.
Wow.
And when my friends came back from these holidays, it seemed that nobody even unpacked, nobody even took it out from the bag. Nobody touched this book. And I was the only one who read it. And then when they came back and they discovered that I was alone who read it, they told me, okay, please, can you tell us something about this? So I started to tell to my friends. It was in library, I remember. So I just started to discuss about ECGs with my friends in library. 2 or 3 friends were around me. And then whole book, I told them, I drew the ECGs for them. And then other people learned, okay, Iya Valiani has read this book. So can you please later, some other people coming to me, can you now please to tell us? So it's later, I had to discuss about this with all my friends. And later they told, okay, Iya Valiani knows ECG. And it happens, of course, when somebody tells you they didn't read later. So from my batch, I think nobody, just one, my friend became cardiologist. And nobody else, because in their mind it was only Iya Valiani knows ECGs, nobody else. So it was very fun and really, and whenever you feel so confident and so proud that yes, I know it because I read these ECGs. And later, already on the 4th year, I was making night duties and attended the special courses for doctors. It was the special courses already for doctors, which was held in my hospital after night duties. I was staying there, and together with other doctors, I was listening. I was a student, but I was allowed to listen. And so after this, I fell in love with ECGs, and since then, I'm trying to share this knowledge with everybody. And probably my biggest passion is to learn myself, and the best way to learn is to teach. So that's why you're obliged to upgrade all the time the knowledge. So that's why probably I became later professor too, because I liked teaching. But it started from the 3rd year, from the very small teeny book about this ECGs.
That the only way to learn ECGs is to have someone else teach it to you, because I had a friend like that in my university. And I feel like I was so scared of learning rhythmology, and he helped me teach. So I'm really glad that you were that person for so many of your classmates and things like that.
Yeah. I will still advise you to read Hampton. Hampton starts like this. ECGs are easy and everything is logic. So already consciously you are getting ready that it's very logic, by the way.
Right.
It's not something, it seems difficult, but when you are starting to read, everything is so logic. And it's very good already to open your mind and think, it's not difficult, I can understand it. And it's very logic. There should be explanation for everything. So finally, it's not so easy when morally and mentally you are ready for reading this one.
Right. And the thing about rhythmology is that the minute you know how to orient the heart, like when you can start looking at the heart, like looking at particular leads, then all you need to do is just practice, right, to figure out certain pathologies or certain
Yes, there is some
diagnosis.
structural attitude, yes, some structured attitude already. When you see ECGs, we know first we have to, for example, of course, I'm not making lecture now about ECGs. We'll be having special courses maybe from about this, even for USMD programs. We are with ecology, we are planning now to do special elective course for in ECGs. But the first thing is to check whether the rhythm is sinus or not, and then it's regular or not regular. Then to evaluate the rate, then to evaluate the axis, and then to evaluate if there any blocks or they are not, and then if ischemia lesion. So everything is very logic, and you have to go step by step. So finally, it's not so. Of course, there's some ECGs that nobody can understand. I remember I was in Paris that time. I was making my internship in Paris, and I was lucky to have a very good hospital, and we had very good doctor in rhythmology. She was the one who showed me how to make pacemaker implantations, the ablations, and everything. Sylvie Dinanian, very famous doctor in Paris. She is still practicing, by the way, and she was among maybe top tens of French doctors in rhythmology. And she was getting faxes from. There was no other sources that time. It was in early, in around 2000 something, and she was getting faxes from her colleagues asking, "What do you think? What is there? Some ECGs there?" And she was showing to everybody, even to some nurses and students, everybody. Do you know what's going on there? Because, well, of course, it was not very easy CGs. It was complicated with some retrograde Venkeback something, but still, it was not a shame for her to ask, because she was saying, "I have no idea what's going on there. I
Right,
don't know what's going on there." And she was showing to everybody, even students. So I was
right,
surprised with how she, professor, she's sharing with us, but it's not a shame. So after this, I don't worry neither. If I don't understand something, I can say I have no idea what's going on there, but I think it might be this or this. So it's better to ask colleagues. If you have doubts, always share. So this lesson I've learned from this lady, if of course many other things, but this is something which made me now more self-confident, and I know that if I don't know something, I can always ask my colleagues. So it's not a shame to ask a question, and it's a shame to just look correct and to do bad things for the patient. So
yeah. So, Dr. Iya, you are also the associate professor in Pediatrics. You are a course director for a residency program, and you are the executive director for the School of Arithmology in Georgia. So, could you tell us a little bit of
yes.
about each of these roles and how you where you work
Okay,
currently
if
and
you
how?
want, I can show PPT. I think it's better to see on the screen what all these things, because it will take, I think, more time to explain. So maybe I'll just share the screen, and I'll just give you briefly this introduction, because it will be easier for everybody to see what about we are talking. So, so already, so you told my name and abbreviation. So I'm cardiologist. Briefly about my education. So I was trained at TSMU, of course, and I made my PhD. I was the, we were calling aspirant of TSMU, but in fact, I made this PhD in France, in University of Paul Sabatier, Toulouse, and later I was specialized in cardiology in two of very famous French hospitals and universities. One was in Paris, and then in Marseille. So here I got the specializations, and from administrative activities, you asked me to give you some brief information about the positions I was keeping. I was very proud. I am still very proud to tell that I was, once upon a time, I was the dean of the English Medical Faculty of Medicine, and I was the youngest dean that time. There was no other female dean as young as I was. I was around 30 years old, like this. So I was very young, and I was dean. And then for 10 years, I was the head of International Affairs Department of TSMU. And so currently my activities, I'm associate professor of the Department of Pediatrics. First I was assistant professor, and for last 6 years already I'm associate professor. I'm course director of residency programs in cardiology. So I'm working, I'm cardiologist. So as cardiologist, I have this residency programs in private, it's a private clinic. Guli, it was the first private clinic who got this accreditation for private residency programs, and now I have 16 residents currently who are studying there. I already had around 100 who have already finished these courses and are now practicing, and I'm so proud when everywhere in Tbilisi hospitals now in the different kind of departments I see my ex-residents, and they're now keeping quite high positions, and they're the mainstream of this cardiology currently. And since the last 2 years, with my colleagues, I have established the School of Arrhythmia in Georgia, and the idea of this is to teach this knowledge of ECG to students, to doctors, to our colleagues rhythmologists. So this is mainly like continuous medical education. So I can say that I'm teaching all steps of medical education. It is undergraduate education, postgraduate, and even later continuous medical education. So this is the if you think we can continue with this presentation, I can just stop it, or I think we're out of time. I talked too much. We had just 20 minutes.
No. We have some time.
Maybe we have to stop and enter.
I'd like to show some of the pictures from this presentation. If we could.
I can just say briefly if you want. I'll just go briefly, and because the pictures are not very interesting, mainly I can go just briefly if you want, and just show you the what I was meaning there. So you had some questions. You gave me some questions, so I obeyed you, and I tried. So about the profession, about the work I'm doing to do. So already I think we spoke about this. About the field, I already spoke about this. And again, if I have to choose, I would again choose cardiology. So there's no other field in medicine which I prefer more than cardiology. So I would still go the same way. I would still enter the same university. I would still do some things. What do you think it takes to be a doctor? To be a doctor, for me, it's lifestyle. It's mental. You are a doctor. It's not that whenever you are putting your white coat, you become doctor, and whenever you're leaving hospital, you're not anymore doctor. You have to be doctor everywhere. Somewhere while the flight somewhere in the sky, when they are announcing who is the doctor, when they need your help, you have to go there. Nobody will know on the face that, okay, you are doctor, so go and help him. No, but consciously you have to be ready that you have to help people, despite you have white coat there or not. Whenever you're walking in the streets and you see somebody is falling and needs your help, you have to go there. So it's not just profession, it's lifestyle.
Right.
So I think this is the main thing we have to remember. So it's not the profession when you are doing something job in the office and you're coming back and later you have to do another work. Still,
Right.
your patients are calling. Still, other doctors from emergencies, if you make consultation, they're calling and tell, okay, now your patient is better or he's worse, what to do. So this is not something you can hang telephone or switch off telephone and later say, okay, now I'm not working, today is weekend. This is the lifestyle. There's no holidays, there's no weekends in your profession. So of course, when you're choosing this, you have to think about this. What keeps you?
Yeah.
Yes. So another question: what keeps you happy? I think you were thinking about, not as all human beings. I'm happy when we have good weather, when the sun is shining. I'm very grateful person, I can say. I'm very happy for every single day given to me by heavens. So when you have good weather, sun shines, I'm happy already. But I think you speak now about the professional happiness. And again, so the first time I realized how happy I was feeling such big happiness in my heart when I first finished my first night duty. It was horrible, of course. I was afraid of this night duty. I was praying, so please, everybody should reach the morning. No patient should die during my night duty. And later in the morning, I was going home back. I was sleepless. I was tired. I was hungry, but I was so happy. So this happiness I felt, I was like, why have I feel so happy? I was proud of myself. I was happy that nobody died. And I was proud and I was happy that I helped people. So this really makes you happy as a doctor. And okay, and of course, happiness and when you are sharing with others and you are learning. So I told you, I myself, I love learning. My mother was joking. So whenever Ia finished all the courses and trainings in Georgia, later she went to France and to all parts of the world. And it's really like this. So everywhere I'm going, I'm trying to be admitted on some courses, on some trainings, specializations. And you can see, so I had, like here, I put some of the trainings I made again. So of course, mainly it's my second home country, it's France. But of course, I like to train and to be trained in other parts. So I'm trying to be updated and to learn all the news what are happening in the world. And of course, it mainly comes from the European countries. So I'm trying to make the trainings and rotations in Italy, in UK, in Austria, in Germany, in Denmark. So everywhere I'm trying to learn something, even about leaderships, about some other relations. So this is very, it's a happiness for me. Lecha, if you have some questions, you can of course talk to
Sure.
me anytime you want.
And definitely. I saw as you mentioned that France is your second home, and also you spoke about a few hobbies of yours that were learning new languages. So,
Yeah.
do you speak fluent French now?
Yes, I speak better French than English. By the way, though my first language was English, and I started to learn French whenever I had to leave Georgia to go for PhD studies. That time, just knew a couple of words like merci beaucoup and chercher la femme. That's all. And I had to start after, so I was already 20 years old and 22 years old even when I started this. And later, when I went to, but I made the PhD in English, of course, in Toulouse because I was just learning there. And then when I went to see my boss in Paris, and I had interview with him first by telephone, and I was still not very confident about this. And so when I met him, he introduced me to his colleagues, and he was saying, "Only thing which disturbs me, she speaks French better than me." So after this, I felt so happy. And we doctors, because we had many patients to treat there, so we had special like recordings, audio recorder. There were no mobile at that time, so spread. So we had our recorders, and we had our secretaries who had to later print this compte rendu, like health history. And the lady was telling, "I can imagine how fast you are talking Georgian because your French is so fast." So I'm speaking very fast all the languages, including Georgian, of course. And by the way, now I have 10 years old child, son, and he, of course, he speaks Georgian. He likes very much to speak Russian. He likes English, of course, and he likes now he studies Chinese. And
Wow.
now he'll going to study French too. So I will be very proud. So my son will
You
talk
pass
even
on
more
your
languages that
multilingual.
I talk. So this is probably hobby, and he's traveling with me everywhere. So this international culture, I think, is interested. And now he's listening to me my English too. So that's why he doesn't like English too much, because he thinks, okay, my mother talks better than me, so she is a bit embarrassed. But he speaks very good Russian, and he speaks Chinese, and I don't speak Chinese at all. So, so my
Thank
influence is there already.
Thank you so much for sharing so many interesting things about your life in cardiology, your life in medicine, Dr.
It's
Ia.
my pleasure.
Thank you so much.
I
Is there
like dealing with students.
yes,
And I'm very happy that you have such good initiative, Lecha, and you have created such courses. And I put the title of the topic was Modern Medicine 2020, because I'm sure it will be continued. So to be
oh,
continued, I wish you to continue later too.
that
You
is
and your friends,
absolutely so sweet
it
of you
should
to
be
say.
tradition. I think we have to keep it like tradition.
Thank
That's
you,
it.
definitely. And in a few years from now, I'll call you again, and your training list would have been twice the size, and probably you've learned Mandarin by then and traveled even more countries. So till then,
Yes,
Dr.
okay.
Ia,
And
thank you.
what time, because I'm teacher, I'm professor, I'm so happy for my students who are later, or my friends on the Facebook now, and they're informing me that, ma'am, now we have moved to California, we entered this university, ma'am, we went there, and they're now spread all over the world, my international students. And I'm so proud. I'm of course giving them recommendation letters, and so I'm also updated with the news, and I'm so proud. Like I'm proud. Like for my son, I would be proud the same way. So of course, I want to hear later from you that I'm sure you'll be very successful doctor in any field you choose, and we'll meet later, and you'll be professor somewhere. I don't know where, but you'll be
And
professor
I will
somewhere.
keep in mind how amazing of a teacher you've been. I will keep
Yes.
in mind all our CBCR sessions, and
Okay. I'm
like
very happy if you remember them, and if
yes,
you just keep even good memories about them. So good continuation. Regards to David Dominguez.
yes,
So, and good
definitely.
luck
He
for the
sends his
session.
regards to you as well.
Okay.
Goodbye.
Bye. Thank you. Bye. Bye.
So that was Dr. Ia, and she was so amazing. I can't believe she had so many great stories to tell. We have one of my close friends, Danielle. She recently had a birthday, so we're going to bring her on and say, Happy birthday! Hello!
Hey!
Oh, is that a little? Okay, we're good now. So
Can you
Danielle
hear me?
is a recent 2020 graduated
Yes.
with the COVID. She is a former American nurse. She's taken her USMLE Step 1, Step 2 CK, Step 2 CS. She's a mom, a wife. She has 2 kids, 2 cats, 2 dogs. There's a list of things. She's a great friend of mine and also a very, very inspiring human being. Today, she's here to talk to us about. Actually, I'll let her tell you.
Hi, Leica. Thank you for the amazing introduction. I feel a little.
I'm your hype
probably too
man.
good for.
I'm your hype man.
Yeah. Like it's. I feel like I should come out and just like, yeah. But it's like it doesn't feel that way at all, especially in this situation.
This whole conversation is going to be just me and Daniel laughing about how unprofessional we're going to keep this. Hopefully not.
Yeah, I'll try to be as professional as I possibly can. We know that that's actually a struggle for me. I'm very relaxed of an individual. Yeah, like I'm friendly with most people. Having a professional doctor.
You have been a nurse in America, and then you moved all the way across the globe with your pets, of course, and you relocated to Georgia. How was that like? And tell us a little bit about that.
Well, I had just gotten my RN degree when I had both found out I was pregnant, and then that my husband needed to go to Georgia to finish up his PhD here. So in making that decision, we came to Georgia. I love being a nurse. I think that being nurses are essential in the functioning of a well-oiled healthcare machine. Like they improve outcomes across the board. And I think that if nurses just improve outcomes in patients in everything that they do. And I really loved being a nurse because I loved the patient interaction. I loved patient education, which nurses are really involved in as well. But I also didn't want to be without my husband for a year. So then we came to Georgia, and the nursing system is not the same in Georgia as it is in America.
I feel like it's generally all over the world, like the nursing system in America, how it isn't comparable. So that led you to joining medical school here.
Yes. So I don't like to be idle. But I feel like an idle mind just creates anxiety in myself. I went to medical school. I found this program. I'm actually a transfer to USMD. I found it a year and a half in, and it was perfect. They had a schedule set. Everything was really well done. And it worked with my time management nature.
You've also taken you've taken these big exams. You've talked a lot to me personally about the way you kind of you really solely rely on your organizational skills, and that is something that a lot of people find hard. And I'm sure even you have had your own difficulties with that. So could you tell us a little bit about, I don't want to talk too much about the USMLE, of course, because it's done.
Great, yes it is. They were wonderful.
I wanted to know personally because you have going through pregnancy in medical school to, you've done it in a way no one else has. And that's kind of why I wanted to ask you.
You hear a lot when people say, if you can't do something well, don't do it. Someone once told me that that's the completely wrong way to think about it. If you can only do something at 30%, do it. If you can only brush your teeth for 1 minute instead of 3 minutes, if you can only do it for 30 seconds, do it. So for me, that was basically my motto in all of life. Like, if you can only study for 10 minutes, study for 10 minutes. Like, do what you can, because every step that you take, everything that you learn, just brings you one step further towards your goal. And I think me being a little bit older going through medical school actually helped me with this, helped me calm the anxiety of, like, if I'm not studying 8 hours a day, what am I doing with my life? If I'm not, like, this is awful. What am I, if I'm not making sure that I volunteer and I do this and I have this many hours in the hospital? If you can do anything, like, just do it. Just do it, and do it as well as you can in the time that you have.
Right.
And that's basically been my motto for getting through everything. So, like, learning microbiology with Julian sitting on my hip and just trying to, like, make songs out of all of the bugs that you have to know. Like, you just do what you can.
Form of ABCs, like actino.
Yes.
Like,
Bacillus, yeah, Clostridium, diphtheria, like, yeah. It was a joy. He actually loved it.
Do you want to share some of the stories? Speaking of Clostridium, do you want to share some of the stories you've had? Not that particular one, probably because.
No, that was actually my first day of nursing school. That story, is that the one that you want? That's the one.
No, I was just generally curious about stories in nursing school.
I have stories. I'll tell two stories. One, like, very far apart, and they don't exactly paint me in the nicest light, but we're gonna keep this informal, like I do with everything. Yeah. My first day of nursing school, the first thing that had come in was a patient who had C. diff, and then she didn't speak English, and this was in America, and she didn't. She had trauma, so she had a craniotomy, which is where to relieve pressure, they remove part of the skull. Yeah. So I go into the room and I don't see her in the bed. And she's on the floor, having fallen and then soiled the floor. And it was a very rough situation for her. And I didn't know what to do. And me, as a brand new baby nurse in my white scrubs, because all nurses wear white scrubs when they're learning, I go in and I have to hold this patient while we're trying to get the lift team to come in and lift her into her bed. And because if I can't pick her up, we're both going to slip. So I'm sitting in C. diff, in white scrubs, and holding a patient, my first day of nursing school. And to explain that I really do love nursing, even after that, is sometimes strange for people. But when you're in a hospital with a patient, it is no one's best day, with the exception of a birth. And a birth that goes well. No one wants to be in the hospital, and it is no one's best day. So if you can reach across that moment and make it any better, any easier for them, like, nurses are the best in this because they're with the patient the whole day. But even as a doctor, you can do it, and it makes your patient reach out to you much more, and you really find out more about your patients, and you can more effectively treat them, because if they feel better, even emotionally, they're going to start feeling better physically as well.
Right.
So
we had some great discussions quite recently about during our public health clerkship, rather, and you had a lot of interesting ideas. Mainly, I wanted you to talk about what you think how you fit into how the idea of minimizing healthcare disparities fit into the way you want to be a doctor in the US.
Going through medicine, you find out that it's not fair. That so much of medicine is not fair to people, and it's not genetic based.
The kind of like the journey a person who's training in medicine goes through too, as well. As in, it's as a whole, like medical education, healthcare. There's a lot of disparities. Like, what is something that in particular bothers you?
My hot button issue is always women's health in general, and a particular healthcare disparity that has always bothered me in America is the maternal death rates for Black women, and the even birth weights for Black infants in America.
Right.
It's across education, across socioeconomic status, they are at a higher rate of death. So accounting for everything else, it shows that there's a disparity there based on their race. And it's so mind-bogglingly unfair that this exists, that women are more likely, Black women are more likely to die in labor. They're less likely to be believed when they have pain. Their infants.
Especially in MI, we spoke about this, I think, remember?
Yeah. They're less, and even if they have pain, they're less likely to be given medications that effectively treat that pain because they're not believed. Even they've done studies on even that doctors, while they don't hold this belief of like, oh, like they're faking it, it's not that. It's that they just are less likely to believe the level of pain that a person of color is feeling. And I recognize that I am a very privileged individual and pasty individual when I'm talking about this. But when you go through medicine, when you're learning physiology and when you're learning the like nuts and bolts of things, it's on a cellular level. And you think that this is how it is for everything. And then you start to find out that it's not, that medicine and treatment of diseases is not entirely based on these things that you spent so much time learning about, these minutiae, these pharmacology and this other things, that it's actually based on access to care and whether you can catch a disease early and whether you can, these people can make it to the doctor or they have trust in doctors, because also there's a lot of mistrust among, in America, among people of color and doctors because of the history of doctors in general. Like it's
generally like it's something that's not a given. Doctor patient understanding, the trust is something that's earned. And I you personally see yourself, this is one of your strengths, I personally can attest to it, is that you are really great at making those connections, which is why I understand that you are inclined to joining a family medicine practice. Could you tell us a few reasons why that appealed to you?
When I started studying, I had originally, because I'm very passionate about women's health, I wanted to be an OB, obstetrician, but then I went to cardiology and I loved it. And I went through nephrology and I loved it. Pediatrics, I love. I just ended up loving everything. So I had a friend a mentor really, who was like, well, if you love everything, you really should go into family medicine. And family medicine in Georgia is not the same as it is in America, because it's a small country and it's very city-based in Georgia, but America, you have a lot of family physicians filling roles that are in critical access areas, where you take care of a patient in both primary care and tertiary care from their whole life, from birth to death. And that fascinates me and it excites me in a way that I feel that I'll never be bored with anything. I'll go from a baby to someone, an elderly individual with diabetes and hypertension, and I'll always have a puzzle in which to go and figure out. And then secondly, I believe that primary care is key to maintaining health of an individual. Going through medical school, the science actually was probably the most difficult part for me. Like learning biochemistry and learning physiology, like it's hard. And for me, it's dry. I love people. I really I really wanted something where I could interact with people and affect their lives for the better within medicine. And I think primary care, the best way to treat a disease is to catch it before it starts, or to catch it early, or to have that access for people. I'm really looking forward to that as part of my job.
That is awesome. So you've also done clerkships in family medicine in the US.
I
So
did
your idea of what family medicine is like, did it match what you saw, or what did you like, what did you not like? Like, could you talk about a little bit of that?
Sure. I think when I first went to the family medicine clerkship there, I was unbelievably nervous because we're told as foreign students that we're behind, that
Right.
you're somehow behind in your knowledge, and when you get into America, it's going to be completely different as working as a doctor. And even me, having worked as a nurse, they were still like, oh, it's working as a doctor is entirely different, and you're going to be behind there. And going there, it actually was validating that we do receive a very good education here, because I was able to, physiology is the same everywhere. Like, diseases are technically the same everywhere with some variations. But being able to apply that knowledge that I learned here, there, was, I was able to do that, and I felt that I represented myself and I represented our program very well in doing that.
About that. Definitely. So, what did you particularly enjoy though, like at the clerkship? Was it just like really hectic work like the whole time? Did you have any kind of real memorable experiences there?
I think I love nephrology. Like, I love the kidneys. So being able to see a patient through from coming in with an acute kidney injury and then being able to diagnose it as a glomerulopathy, and having everyone kind of listen to me, and speaking with nephrologists as well, because I think one of the strengths of family medicine is a coordination of care. In Georgia, things are very insular, where you have a problem with your kidneys, you go to a nephrologist. You have a problem with your heart, you go to a cardiologist. But this is a lot of patients diagnosing themselves of like, oh, I must have a problem with my heart, I have pain here. And it's like, well, you might also have problems with your kidneys, and you might also have problems with this. So being able to coordinate care and actually hold my own, talking with specialists and fellows and residents as well, residents in family medicine, and being able to coordinate care for an individual who has multiple problems across the board was just amazing.
It's a lot of you kind of have to keep learning as you go. There's never really, you're not restricted in any way. I think that's basically what that appeals to you, right?
Yeah, I think as a doctor, you can never, as anyone, you can never know everything. And you always have to be open to the idea that you could be wrong, or that you don't know, you just don't know it. So you have to find the answer somehow, because when it's someone's life on the line, you need to find that answer. And it's okay that you don't know it. It's perfectly okay. But like, if you continue not to know it, then it's not okay. So you really have to like be open to being wrong, and be open to being basically stupid. Like, you have to be like, oh, I was not smart there. But like, okay, now I have to.
I'm gonna get this right this time.
I'm gonna get it. I'm gonna do this time. And that's basically the story of my life, is being stupid and then being like,
also goes into a really important quality that a doctor should have. So before I let you go, I wanted to ask you this question. I asked all of everyone this, and I already know a few things about how amazing of a doctor you're going to be. But could you tell us what qualities do you think are very important that a doctor should have?
Sure. I think one of the main ones is that you have to be non-judgmental about anyone who comes in. You have to recognize your own judgments for that. To be non-judgmental, you really have to know who you are and what might be your triggers. I know certain people who have a problem with when a patient comes in who is a drug abuser, or a patient who comes in who is an alcoholic, or some types of anything, really. You have to know what your trigger issues are and then be non-judgmental in treating a patient. Being open, because you never know where their life led them to that. I know in Georgia particularly, there's a lot of heroin abuse and drug abuse in a generation that's kind of a lost generation that happened during the 90s and the 2000s, where it was not a good place to live, and these young men didn't have options. And I think that if you have them come in and you just
look at them yeah,
and they can feel that. And I really think that like the key of being a good doctor is a doctor-patient relationship. Is having your patients know that they can trust you with their health, because you're not going to be like, well, this is their fault and I'm going to be judgmental about it. It's like, no, the only thing I care about here is for you to be healthy in whatever that means to you. And I think that is the main thing that I want to impart in general as what is important to be a doctor. There's lots of other things. Time management is also key. Being a nerd is also key too. Like, you have to really like what you're doing. I think the doctors
like it.
Even when you don't, you have to like convince yourself, no, this is cool. This is really cool. I'm gonna learn the entire glycolysis because it's cool. No, it's not. I don't remember it, but you have to know it. You have to trick yourself into like loving it.
Right.
But
I think we've all done it in our own way. Yeah.
We all have,
Thank you so much, Danielle, for coming on here, sharing your story. I really wanna. Are any of the babies around, or probably if they were around?
If they were around, you would have seen them. No, they're in the other room. I have a cat sitting here.
Let's say hi.
She's not gonna like me when I do this. Come here, baby girl. Oh boy, she's big. She's a massive cat.
Thank you so much for joining us. You are amazing. Good luck with your applications and everything this year. You'll be applying, and good luck with that. Thank you, Danielle.
Thank you, Lisa. Thank you so much. This was fun.
Yeah.
Bye.
Bye. So that was my classmate, my good friend, Danielle Foster. Now we have a very interesting person, one of my mentors, one of my teachers, Dr. David Dominguez. He is a pediatrician in the Boston area. I would like to introduce him here. Hello, Dr. David.
Oh, hi, Lekka. How are you? Good to see you.
Can we hear you?
Oh. My
think we're
mic is muted. Sorry. Can you hear me? Can you hear me now? Oh no.
Do you want to perhaps?
I'm speaking into this.
Hello.
Computer mic. No.
Okay. Perhaps I can take you out and you can re-click the link that I sent you. Yeah.
Okay, sure. We'll try.
We have technical difficulties sometimes. This is my first time ever hosting an open broadcast using open broadcast software. It can be a bit tricky. There we go. Yes, we can hear you.
You can hear me. Okay.
Awesome.
Hi, Lekka.
Technical difficulties. Stand by. Hello, Dr. David Dominguez. Thank you so much for joining in here today. You are a pediatrician in the Boston area, like I mentioned. You've been you've gone to medical school in Harvard University. You did your undergraduation in Rice, and you've been an instructor for becoming a doctor in the USMD program while during your time in Georgia, and now you're back in the US. So could you tell us a little bit about how it's been like being a pediatrician in this time, especially during quarantine?
Okay. Well, again, first of all, thank you for having me, and good to see you, Lika, and it'll be good to connect with other USMD students as I got to experience classes of 2019, 2020, 21, and some of 2022. So it's a real pleasure, and for all the younger students. So during this period of COVID, as with all of us, my work as a doctor has completely turned upside down. And so basically, because I work...
asked about COVID is because you mentioned a very interesting thing about how children being kind of a reservoir of the flu, and now since daycare and schools and universities and everything has closed down, how has that basically affected practice?
Right. So because I'm in private pediatric practice, we don't get all the personal protective equipment that a hospital would get through their contracts. And so because of that, we don't feel comfortable. Our boss, our leader, has decided that we're not going to see sick patients in our office that could cough on us, sneeze on us, and give us COVID and spread it upon people who are more vulnerable there in the office. So unfortunately, we're not seeing sick patients in the office, but we're seeing them by telehealth. And we're only seeing patients that need immunizations and necessary well visits. But it turns out that because of no daycare, because of no school, pediatric infectious illness is just dropped. And so they're not sick. And so it's interesting how really daycares and schools... daycares and schools are really the reservoir, and these kids just spread everything around. So,
So I want to kind of take a little trip back to memory lane. I wanted to ask you, you went to Rice University, you studied biochemistry as well there. And could you tell us like how that led to choosing medicine?
Well, right. So as a freshman in college, I went in and I thought I was interested in the biosciences, and I said, okay, well, let me just give this pre-med thing a try and see if I can hack it and handle it. And I found that I really liked it. And academically, I said, okay, I want to be a doctor. It's great. It'd be a great thing. And then I got sick my freshman year of college. I actually I had a viral illness, and then turns out I had petechiae all over my body, these little hemorrhagic spots, and didn't know what that was. And when I went to the doctor at the health services, he diagnosed me with ITP, which is idiopathic thrombocytopenic purpura. And so I was hospitalized and for 5 days in the middle of a busy semester. And so I got to see the work of the doctor treating me, and
on the other side.
Yeah, and how, basically they saved my life because my platelet count were 4,000, which I'd be susceptible to spontaneous brain bleeding. So a very dangerous situation. So it just further cemented my desire to be a doctor, that experience.
So how is medical? So you were born and raised in the US, right?
Yeah.
So, and recently you made a transition to Georgia. And not recently, but how did that come across? I mean, how did that come about, rather?
Okay. Yeah. Well, I was doing very well in my career as a pediatrician. I finished residency and was practicing for about 7 years. And then we decided that we were just going to me and my wife and my 2 kids decided that we were going to do something different. And we decided that we would go and first we went to a different country, Timor-Leste, and then we went to Georgia. And we decided that we were just going to help communities there. And so I decided, and I figured that the best thing I could do in Tbilisi would be to teach, because, I had that experience from the US. And so it happened that I stumbled upon the USMD program, and it was a great fit, I think.
And we're grateful for that, for having you. So how was your time? What lessons have you kind of learned over being a teacher, like especially in a subject like becoming a doctor? Um, what do you think are milestones, especially for a student becoming a doctor?
Right. So, well, first of all, it was very enjoyable teaching in that course because you got to see, for me personally, I got to see maturity, students coming in on the younger side and becoming more skilled and more confident and learning the basics.
Yeah.
Yeah. So I think.
Yeah. So you spent about 2 years teaching. 2 years teaching with us, and you've gone back and continued your practice in Boston, right?
Yes.
Yeah. So I wanted to ask you the main question: why pediatrics?
Okay. Yes. Good. So pediatrics, I decided that during med school, I thought I was going to do internal medicine and maybe try to specialize in internal medicine subject, which is great. I know you interviewed several cardiology, some DECA, and yeah, so that's a wonderful field. And but then what caught when I did my pediatric rotations, and I really enjoyed my patients more in pediatrics. It turns out I like kids a lot, and it was really fun and enjoyable because they're just so hopeful, and parents love them so much. They're innocent and pure, and in general, they're nice and they're healthy for the most part. But when they get sick, you can really use your expertise to drastically help them. I like it in any other field, but I thought kids were special.
Yeah, I don't know whether it was personally because you were one of my favorite teachers during medical school, or because I personally ended up really taking towards pediatrics, and I feel like that's something I see myself in, mainly because you need to communicate with kids. You kind of have to get down to their level and have that understanding, and they're also incredibly resilient. What advice would you have to people, or what advice would you have for someone like me who wants to get into pediatrics? What do you think keep in mind?
Well, I would say that it is, don't fret if it's challenging in the beginning, because it's not like it's easy to take care of children as well. Because even though they're cute, there's one thing about playing with them and having a nephew or a niece or child, and it's another thing caring for a sick child, because they are miserable and they are crying at the top of their lungs. And so even now,
you're trying to hospitate them.
Yeah, you hear, but I can hear murmurs and crackles even though they're crying. So
it's a skill.
It's a skill. It's a skill that comes through practice and trying to look in a kid's ear who's like screaming and moving their head around, and you're sweating, and there's a twin in the room, and so it's kind of like a controlled chaos.
And worried parents.
Right, worried parents, and they're not holding them correctly. So, but you get accustomed to it, and the goods far outweigh the bads.
So thinking about parents, what are the barriers you usually have, like conversation wise? What are barriers you usually have with your pediatric patients, with their caregivers and people?
I wouldn't say barriers. I think the major thing is that we're
perhaps like like people who have trouble with vaccination. And
right. So definitely, there are a lot of good things about. In pediatrics, you have their parents, because especially when they're younger, and that's a whole other skill that you develop. That you have to develop with, because parents are just extremely protective. In most part, they're extremely protective, and they want the best for their children. It's their precious children. And so, and then you also have the challenge of parents that are not as cautious as they could be, or that are neglectful, or even abusing, which I've seen. And so there's that challenge. there's a challenge of communicating them based on their educational level, and also anxiety. A lot of parents come in with their own difficulties. Sometimes they have some issue of their own, anxiety or depression, and getting to talk to them and trying to understand them and realize that
because the way they can directly affect the care of your patient, which is your child.
Right. Right. So you just have to learn how to really, through experience, be able to talk to them and try to figure out how best to help them.
Right. We spoke about this before, like how the doctor, the pediatrician, the parent, and the teacher are the three most the people who observe changes in a child most. And what do you think about just generally, if you had any thoughts about qualities a doctor should have, a pediatrician in particular, or just doctors in general should have?
Okay. Right. So, well, I'll talk about, maybe I'll talk about a pediatrician, because I know you've had many people talk about the qualities a doctor should have. But pediatrician, first of all, you do have to like children. And if they're kind of annoying to you, it's just not going to work. But I think actually you have to have some degree of patience baseline, and then that just gets developed even more so. And just inquisitiveness, and also actually to have fun with your patients too, as much as possible, because part of pediatrics is sometimes they're well, and you want to develop this relationship with them. You don't want to, one thing that as a person training in pediatrics, and once you're a pediatrician, whenever you have a patient, say they're a young toddler, and then you have a mom in there, you shouldn't just talk to the mom and leave the baby out of the picture, that the child out of it.
The third person or something.
Right. You should actually get down there and try to look at the child, however old they are, and talk to them as well.
And give you an idea about milestones as well, right? Like you have to do language delay, any language delay, perhaps social delay.
Exactly.
It's
exactly. So you're making behavioral observations as you watch the child.
Yeah. What do you think is the most interesting part about just interesting part about being a pediatrician for you personally?
Yeah. Please
go ahead.
Right. So in primary care pediatrics, the thing about what's interesting is, because you can be a pediatric subspecialist. There's so many different subspecialties, and they're great. In primary care, you're kind of the frontline person. And so you could see, what's the thing that I like about it is that in one appointment, I'd be seeing a newborn. And then in the next appointment, 15 minutes later, I'm seeing an 18-year-old.
Right.
And you could have completely healthy kids, and you're just monitoring their development and their growth. You're getting to know the family. Everything is hunky-dory and fine. And then you have another patient who has this insidious, serious condition going on. And as a pediatrician, maybe you're not seeing as much pathology as other doctors, okay? In medicine, you see pathology, especially internal medicine, et cetera. But in pediatrics, you're seeing a lot of wellness, but you have to be keen to figure out when someone is really sick or has a serious problem. And so that comes through your knowledge, your observation, communicating with the parents, and picking up on subtle symptoms and subtle observations and physical findings.
Like good history and physical exam.
Exactly. So, and that's what I was trying to teach in BAD, that basic history and physical, which actually leads you. Yeah.
Dr. Dominguez, thank you so much for sharing so much about being a
Sure.
pediatrician, and your time here with us.
Yes.
It's so valuable and amazing, and it's always great talking to you. You've been quite an inspiration for a lot of us here. And I told some of our students that you asked about them.
Oh yeah, and actually, I'd really love to touch base with all of my past students. Especially, I'm really proud of when I'm looking at Facebook and seeing all their achievements, and now the 2020 class is graduating, so I'm extremely proud of you guys.
Thank you so much, Dr.
Okay. All right.
All right.
Good to see you. Take care.
So that is all we have for you today. We had primary care, pediatrics, internal medicine, and family medicine, and 3 amazing discussions with 3 people. I hope you enjoyed today. And tomorrow will be the last day of More Than Medicine. We're having Suture Sunday with Women in Surgery, Dr. Lika and Dr. Kiea, and the Med Plumbers, which is a surgical interest group by the students of USMD, which will have Pranay and Yegi. So tune in tomorrow. Tomorrow is our last session. Thank you so much for staying with us this far, and hope to see you tomorrow.